Please.
For some reason, I feel President Reagan's arm on me shaking me. And he wants me to say to you, if I was president, we'd have capped malpractice. If my people were in the Congress, we'd have done this. This is as partisan as the uninsured issue. When you interviewed Republican voters through the whole debate, they said cap malpractice, top priority. When you interview Democratic voters, it's at the bottom beyond, please make sure the waiting room is clean. It just is what, and so it sits with one party and not another. And it's worked out, and you can argue if it has to do with trial lawyers or what, or union views, but it's highly political. I'm not arguing the merits of it, but if you look at states that have limits on it, they're driven by one party for that. And the issue has lost its ability to be rationally discussed. One group, the Chamber of Commerce thinks we need this as a top priority. The FICIO thinks this is the end of working people having access to courts. So this will shift back and forth based on the politics because the parties do have a very different view on this. That's all I agree to acknowledge for President Reagan tonight.
We have somebody back there, or five? Yes, I see the hand.
So to Bob and Stuart, do you feel that the current administration has done a good job communicating to the public about what the healthcare reform bill means to them since the passage of the bill? And if you feel, as I do, that there hasn't been a lot of information since the passage of the bill, what do you think are the key messages that they ought to get out so that the public can understand better what it means for them?
What do you think? The administration has the same problem that Stuart and I did. It's 2,100 pages. There are hundreds of things. It's Secretary Sebelius, it's like reading a telephone book to an audience. So it is hard. There are 3 or 4 very popular things in the law, and for that, the biggest message for them now is to go for what you call in politics the status quo view. It's passed, give it a chance. So if someone hired me, that's what my message. Give it a chance, you can always change it. Let's go with the status quo. Let's give it a chance. For that, trying to convince people how it would work for your hospital moving to Iowa, I just think it's very hard. But time is on their side. The biggest problem is getting through 2010. If they can get through 2010, it's just like with Massachusetts. 3 months later, we might have repealed this in a referendum. But as time goes on, it's on the side of implementing it. So the most important thing that exists in Massachusetts for the bill that does not exist nationally, in Massachusetts, there are groups meeting privately of physicians, executives who support trying to make this bill work. I went to Texas. The governor was on TV. He said, I wouldn't implement this, you're going to have an oil leak before I'm going to do this. And there's nobody. The business community says this is an interference in our lives. And so if for people to do this, there has to be people on the ground who are out of government, who are in leadership, talking about how to make it work, how to fix this, but a sense that it's going to go. Also, the religious community is very important here to argue that this is something that should be given a chance. So I think a lot of this has to do not with just the administration, but with leadership on the ground in different parts, making an effort to get through 2010 and try to depoliticize this as something that should be given a chance. That's my view of what I would aim at.
President has a bully pulpit, but there are a lot of other issues that poor guy has to deal with, and he's spending a lot of his time at the Gulf, and it's just so much that he can do. The other, I agree with Bob. One of the things that most people don't realize, there are 1,500 places in this bill which say, and the secretary shall do, which means the people who drafted the bill didn't know what to say, so they pushed it off on the administration. I have a lot of friends that work in the government. They are running 24 hours, 7 days a week, trying to think through all the implications of this bill. And as a matter of fact, I heard today where the administration is beginning to rev up to explain the bill more. Because the answer is, I think the answer to your answer is, no, they haven't done as good a job as they could do. But given all the pressures on them, and it's understandable, but I think they are going to rev it up, because you know what? Come 2010, this is going to be the single, well, maybe not the single, along with the bail, giving money to the banks, and, did he clean up the birds and so on? And did he do enough to stop the oil spill? And a few things about the war. But it's going to be a very important thing. So, yes, he could do more.
Paul, do you have any final thoughts on this?
No, I think they've said it nicely. Thank you.
I think they've said it nicely, too. Complicated issues, tough questions to be asked, but I think the lesson we can learn from this is that this discussion is important. So I want to thank the two of you, the three of you, for teaching us something tonight. Thank you very much for moving it ahead.